Out of Words, a podcast about being autistic, mental health, and life beyond the script. Today we are skipping the small talk to discuss autistic zebras, and that's really comorbid health conditions relating to being autistic. My name's Kitty, and today my co-host is Erin. I go by she, and Erin goes by they/them. So thank you so much, Erin, for joining me here today.
Thank you.
Myself and Erin know each other from through being autistic, really.
Yeah. Yeah.
And similar experiences. So I thought it would be really good to have Erin on today because, like myself, Erin suffers with some of the kind of common health issues relating to being autistic. First and foremost, I want to say, like a lot of these episodes, I am not a doctor, either is Erin. We are very much coming from this from a non-medicalized view, in that we're talking about our personal experiences and the experiences of like a lot of autistic people that we know, of course, people in the community. So, there are some studies, some stats available. I will have some citations at the end. So if you are watching this anywhere that you can see the screen, like on YouTube or similar, you can take a screenshot of that later on when those citations pop up if you do want some further reading. But again, we are to not make this like the longest video in the world. We're not going to go into all the studies and the research, but I will start by saying that there is very, very little research. So firstly, when we talk about comorbid conditions, basically what comorbid means, and this is something I keep realizing that a lot of people don't know what that word means.
Yeah.
Unless you're like sick in the chronic illness world.
I've noticed that.
You don't know that term. So just to say really quickly, a comorbid condition is any secondary condition you might have. So, I mean, which is the first condition, which is the secondary, it depends what way you look at it. But for a lot of people, there might be common comorbidities. So they might have one health condition. Like the connective tissue disorder I have is Ehlers Danlos syndrome. A lot of people have issues relating to that, like POTS is another secondary condition. It'd be very common secondary condition with Ehlers Danlos syndrome. But that's not to say that everyone that has EDS has POTS and vice versa. But that's, it's a big thing in the medical health world, both in the physical health and with mental health. So today we are going to be mostly focusing on physical comorbidities. I think there is, fair enough to say that there is quite a bit of research between looking at the mental health comorbid conditions with being autistic. Particularly things like bipolar, there's some work around schizophrenia as well, BPD and things like that. But today we're going to focus more on the physical side, which there is a lot less research in, but it's definitely something that I don't think can be disputed by even Ehlers Danlos doctors. And it's something I think we want to discuss because I think awareness is very, very much needed, because
100%.
a lot of autistic people themselves don't realize that they might have these health conditions. So I'll start by, I suppose, talking about the conditions I have that are related to being autistic, and then Erin can then talk about a little about themselves, if that's okay.
Sounds good to me.
So just to start off, as I was saying, I've got a connective tissue disorder called Ehlers Danlos syndrome. And Ehlers Danlos syndrome is, as I said, connective tissue disorder. So what that means is it's a genetic disorder that you are born with, you've inherited it. Does not necessarily mean that your parents have it. Of course, like a lot of inherited conditions, it can skip generations. You might not know people in your family that have it. A lot of them themselves might have it and not actually even realize, of course. But connective tissue is basically the glue that holds the body together. So collagen is probably a word I'm sure that a lot of people out there have heard of. So basically I have faulty collagen. And because I have that faulty collagen, the faulty glue that holds the joints together, my joints are likely to partially dislocate and to sometimes fully dislocate. That for everyone can look differently. For me, it's most of my joints, unfortunately. There are 13 types of Ehlers Danlos syndrome, and closely linked with that, there's hypermobility spectrum disorder, which I think there's around 6 defined of that type as well. So when we talk about joint hypermobility, I think we should start at the very, very basic. So just because you have hypermobile joints, that's joints that overstretch, does not mean that you have a connective tissue disorder. So I think when we talk about this in terms of being autistic, it is something to note that a large amount of the autistic community, particularly those that are born female, will have hypermobile joints. that in itself isn't necessarily a medical issue. You should only really be concerned if you've got hypermobile joints and pain.
Yeah.
So if you feel like your joints are dislocating. But I think it is worth pointing out that a lot of people dislocate their joints and are not aware that they dislocate their joints.
Absolutely.
So when we look at hypermobility, I think a good way to kind of look at it is, you definitely would have heard the terms double jointed. And a lot of people hear of that and they don't think a medicalized condition. Of course they don't. So there's a lots of reasons why you can be hypermobile or double jointed and it not be a medical problem as such. A lot of people can make themselves more hypermobile. Like if you start to do yoga and you get really good at that, then you've acquired hypermobility. And again, that is not a medical issue. So we need to define the difference here. Yes, if you're autistic, from what we can tell, from very, very little research that has been done, but also just from people showing up at hospitals having the two conditions, is that you are more likely to have hypermobile joints. And if you have hypermobile joints, then you are more likely to possibly have Ehlers Danlos syndrome. Again, there's 13 types of Ehlers Danlos syndrome. The least rarest form is the hypermobility Ehlers Danlos syndrome, and that's the one I have. I also should say that just in the pronunciation, because I'm aware I'm saying Ehlers Danlos, and depending on the world where you are, you might say Ehlers. So you'll probably hear both, and neither's wrong. I'm going to say neither's wrong.
Yeah, that's right. Yeah.
I tend to kind of just mix between the two.
Yeah.
So yeah, just to kind of say that if for anyone out there who's like, why is she pronouncing it like that? It very much depends where you are in the world, and what you first heard it as pronounced. But all doctors I know pronounce it differently. I think it's just really important to discuss EDS separately on its own and these physical things on their own, because like many people, I wasn't diagnosed with this debilitating condition until I was in my late 20s. And I had been told for a good few years that, we're pretty sure you have this condition. So I was born with things like hip dysplasia, which was left untreated. So, I got arthritis very young and things like that. But I really didn't know. I always felt like my joints were dislocating, but I didn't really know how to discuss that with a doctor. And for years, I was just kind of told, well, there's something going on, but we don't really know what it is. And then in my 20s, things got a lot worse. I did start to become a lot less mobile. My joints were dislocating more and more. The arthritis was getting worse, things like that. And I was actually first diagnosed with dysautonomia, so a type of POTS. So it's basically, I won't go into that as a comorbid condition. Technically, you could see that as a comorbid condition to being autistic. If Ehlers Danlos is connected to being autistic, and then POTS is connected to Ehlers Danlos, you can have like almost a tree of conditions.
Yeah, absolutely.
Like a family tree.
Yeah, that's a good way to put it.
But I think, so with POTS, the way that presented for me was that I always had low blood pressure. I was collapsing from the low blood pressure and fast heart rate. And sometimes I was having very low heart rate as well. So immediately I was told, we're pretty sure you have some form of dysautonomia. Diagnosed with that, and closely, when it was only when I went to Google that I saw closely linked with that was this condition where your joints dislocate, and everything for me, excuse the pun, clicked. My joints clicked, my brain clicked, everything clicked into place. But I didn't really want to tell a doctor that like I was self-diagnosing at this, so I just kind of kept it in the back of my mind. Did a little bit of research, and then eventually doctors started saying it to me. Actually, more so physiotherapists started saying it to me.
Okay.
But it was really like, people in this country, people in Ireland, find it very difficult to get a doctor to commit to it.
Yeah.
They're terrified of Ehlers Danlos syndrome. They also have this idea of like, what's the point in a diagnosis? Because at the end of the day, there's no cure. And like, we do not, I just want to say here and now that is fucking ridiculous. If your doctor thinks you have Ehlers Danlos syndrome, and it should be really usually a rheumatologist who is diagnosing you with this condition, but also your GP and a good physio will be able to tell the difference as well, and will be able to notice that your joints are hypermobile. And if you're in pain, obviously they're big warning signs. But we never discuss other conditions. We would never say that about MS or lupus. What's the point in a diagnosis? There are treatment options. Even just having appropriate physio, not just random physio. You need to be so careful just knowing yourself and knowing your body and dislocating less. Like, there's a lot of things that you can do at home to ensure your safety. But anyway, that's a rant for another time, and maybe even parts of later in this episode. But just to kind of go back to, I suppose, what this connective tissue disorder is, because you have collagen everywhere in your body, it's not just your joints that are affected. Your digestive system is affected. Your organs can be affected. Depending on what type of EDS you have, your vascular system can be affected. Internal bleeding can be quite common, particularly in your gut. heart issues, ruptures. A lot of things can happen because of connective tissue disorder, things with your eyesight, your hearing, mouth ulcers, all sorts of weird and wonderful things. We also quite have thin skin, so you could cut and bruise easily. A lot of things. Anywhere there's collagen in the body is affected by Ehlers Danlos syndrome. So it's really important to note that it is not just a condition of the joints, but it's also important to note just because you have hypermobile joints does not mean you have Ehlers Danlos syndrome or hypermobility spectrum disorder. However, I do firmly believe that because of the high numbers of people we see presenting with both autism and Ehlers Danlos syndrome or hypermobility spectrum disorder, in a perfect world, I think anyone would be walking into the hospital being diagnosed with this by an appropriate rheumatologist, sometimes a geneticist, and then, especially if they're an adult and they aren't already diagnosed autistic, they should be able to have that assessment.
100%.
And we don't, obviously in this country, we don't have public assessments for adults for autism, and we don't really have it for EDS either.
No.
The consultant I see for EDS that diagnosed me, I've mentioned him on other podcasts and I'll mention him here. His name's Brian Mulcahy in Cork. He has worked in London. He is by far the EDS expert in this country. He's private. He's one of the only ones. And as Erin can contest to, unfortunately, he's usually quite busy. Most people he's not able to. I would still say, anyone out there thinking of booking Brian Mulcahy in Cork, try and do that.
Yeah,
he's a great rheumatologist, but he is very busy. Generally isn't taking anyone on his books because he is the only one in the country. Now, in saying that, like many people, after I had that diagnosis in Cork, I still needed to go to London for further testing and further diagnosis and everything else. And it's a lot of money, and you cannot go in any schemes or anything like that, any of the travel abroad schemes, because basically this condition does not exist here. They will not they will tell you in hush secrets in the background that we're pretty sure it's this, but they won't write it down anywhere. And they don't see how harming that is. It's I don't care that there's not a cure. Obviously there's lots of various treatments, and it's hard to get physio or pain clinic or anything else when you don't have a proper diagnosis on paper. It's vital to know there's a lot of safety aspects as well to having this condition. If you're getting surgery, your surgeon needs to take a lot of things into consideration. I won't even go into, because I don't want to be trauma dumping right now in the middle of the amount of times that I've nearly died by the hands of the HSE because they simply have not listened to me or listened to a doctor that knew better than them or anything else. So it is it's a safety issue, and people have died of EDS that did not realize they had the condition. So that is why we really want to talk about this today and spread awareness. Again, just because you're autistic does not mean you have Ehlers Danlos syndrome. But I will say that one of the things, especially when I meet an autistic woman, that one of the first things I say to them is, "How's your joints?" And I always find it really funny because, again, a lot of people don't realize that they're dislocating. When you have born with something, when you have something your entire life, it might feel like you're dislocating, or you might have an idea it feels like my joints are pulling out, or partially dislocating. But I think you just realize, no, that's silly.
You gaslight yourself.
And you don't know any difference because if you're born with something, sure, 100%. You don't know what it's like to, for lack of a better term, be normal. So I often ask women when I first meet them that they tell me they're autistic. I say, how are your joints? And it's so funny because they'll be like, oh, they're fine. Oh, except that they will pop out. I'm like, what do you mean they pop out?
And then, it's so normalized.
And I have to explain to them, you're just used to this, but this might be Ehlers Danlos syndrome or hypermobility spectrum disorder. And some people have randomly heard about it and they're like, oh wait, I think I've heard about it from other autistic people. Because people are in the same communities. Or they've never heard about it and they're in absolute shock. Because they're like, I am actually in a lot of pain. And I'm like, why are you, this grown woman, presenting with pain, not getting help? And you're just told this is normal, or you just believe this is normal. And then they start putting things together going, actually a lot of my family members have this too. And I'm like, well, that makes sense because it's genetic disorder and no one's diagnosed with it. And it's awful to see that.
It is.
And just, I suppose, to go back to I know we're talking kind of hypothetical here, or we're talking from lived experience, not just of us, but of literally probably 100 people that we've both met. But I will say there is, some studies have been done on this. I think most of the studies that or most of the research, I should say, that have been done is literally just doctors noting it. I think a lot of EDS doctors will just say it. They'll say it very factually now at this stage that oh, you're autistic. Yes. Well, there's a link between that. but there has been like a couple of studies done. As I said, there's been more, I think, research from what I know of that's been done around the links between kind of the mental health side of things, and there needs to be a lot more research done in
Definitely.
this area. There was one study, I believe it was a Swedish study. I will try and link that in the citations. That looked at the similar genes that were causing that they think might be causing both the
Mm.
autism and like Ehlers Danlos within the same patient.
Yeah.
At least the hypermobility, if not exactly EDS. And again,
Yeah.
if you're hypermobile, then you possibly have EDS.
Hmm.
I think that study looked particularly at mothers that have EDS or hypermobility in general were more likely to give birth to children who are autistic,
Oh,
which makes sense
interesting. Yeah,
because
it
obviously a
does.
lot of people can be hypermobile but not diagnosed with anything because there's no appropriate doctors, and that's
Hmm.
a worldwide issue.
Yeah,
Obviously it's
of
an Irish
course.
issue, but it's an issue worldwide, the
Absolutely.
lack of diagnosis for both EDS and for being autistic.
Hmm.
um there are like a list of other comorbid issues. I would say the main one, the most that's probably been done research, and I think the one that most doctors would know about is epilepsy.
Mm.
I didn't actually know this link.
No, me
You
neither.
weren't. I don't think you were aware of the
No,
link. And
no, me neither.
it was literally only. Now didn't have epilepsy as a child. I just had it from giving birth. Again, thank you the HSE for doing that to me. So I acquired epilepsy while giving birth, relating to the EDS and relating to the carrier malformation, which is part of the EDS. And it was, funnily enough, I was in like an epilepsy ward at one stage, being monitored, the monitoring unit,
Hmm.
and all wired up. And I was reading, I think it was Pete Warmby's book. It was a very good book anyway. Yes, it was. It was Untypical. That's what I was reading. And he vaguely mentions in that the link between both autism and EDS, obviously, which I knew at the time, but also the link between epilepsy and autism, and that there was a high rate of that. And I was really shocked, especially
Yeah,
being in hospital at the time.
yeah,
So I never knew that I was more likely to develop
yeah. I
epilepsy.
didn't know
I
that.
didn't have it as a child,
Yeah,
and yeah, I just found that very interesting. And I asked the neurologist when he was doing the rounds. I was like, I just literally read this, and he was like, "Yep, yep,
yeah.
that's big link."
It's mad.
And there was a couple of other people on the ward with me
Yeah,
that were autistic as well. So I mean,
yeah.
that
That's
that made sense then. I was like, oh, that there's more autistic people here on this ward than
yeah.
usual, I suppose. So it's an interesting link. And again, that comes back to genes. I would say epilepsy is probably the most researched, the most longest known, I
Mm.
guess, comorbid condition, physical condition to being autistic. But the last few years, there's a lot of again, not research, a lot of like signs,
Hmm.
and doctors are very EDS doctors are very aware that a lot of their patients are neurodivergent and most likely autistic.
Yes, yes,
So I know that, Erin, you are diagnosed with FND,
yes,
um, and as we kind of briefly discussed there, very much believe EDS as well.
yes.
I think
Highly.
most people can see that from a mile off. It's just
Yeah,
getting the
it
diagnosis is
is
extremely
exactly.
difficult.
Yeah, exactly. Yeah.
Do you want to tell us a bit about your experiences and just FND as
Sure.
well in general?
Yes, so I have been diagnosed with FND for about 2 years now. It started out for me as, I mean, I've always had chronic pain, which I can now link back to the EDS, but I in about around 2023, I went through some pretty traumatic experiences, and then I started having really extreme weakness in my limbs that kind of turned into near basic paralysis, where I would have to crawl up stairs on my hands and knees, and I couldn't like what used to be a 5 minute walk was taking me an hour to walk. And so I went to the hospital. I was in hospital for like a month, and I had really severe infection that they thought was causing that. But I had surgery to clear the infection site. I had tons of antibiotics, and still symptoms just got worse. Um, and I actually went because of this. I ended up going into kind of starvation mode at one point because I wasn't able to make food for myself, and I had to go back to hospital by ambulance. And then I was in hospital again for another 2 weeks on the same ward, and that's when they got a neurologist down from Dublin to assess me, and that's when he watched me walk and stuff and diagnosed me with functional neurological disorder. And I was so shocked. I'd never heard of it before, and I was kind of given the impression that like this is all because of trauma and mental health
Yeah.
issues, and that you just need to do a bit of physio and CBT and you'll be grand. But at the same time, they're like, okay, I was like, okay, well, when are they coming to see me? Like, well, they're not. Physio discharged you downstairs in A&E. They're not coming to see you, and our there was one psychologist there, and he was on holidays, so that they're like, yeah, just get your GP to refer you to your local psychiatric unit. I was like, okay. And so that's how it's been the last 2 years. I've had no treatment for the FND. It's fluctuated on and off. Thankfully, right now I can walk, but it has massively reduced my mobility. It causes hallucinations and stuff like that too, and it can destroy your life.
Yeah.
Yeah, But I mean, I think what's helped me most is finding community. Is like finding as it would be with the EDS, and is it's finding that a lot of people with FND also have autism, or some form of neurodivergency, and it's interesting to see the link between the two. And again, like with EDS, there's very little acknowledgement of it. There's very little treatment for it. There's very little, like, I don't know if it's even like, I think it's in my notes, but I had to chase doctors down for weeks and months and ringing every single day because it wasn't on my notes and I couldn't get disability then and stuff like that. And
Yeah.
it's crazy. Yeah.
It's always so funny when they're like, well, what's the point in a diagnosis without cure? And it's like, well, yeah, it's things like that,
Yeah,
disability payments,
exactly.
physio, anything. Like, just
Yeah.
you deserve to know. At the
Yeah,
end of the day, you deserve to
exactly.
know your treatment, or
Yeah.
like what's going to happen to you, what you should be prepared for. You can
Mhm.
do a bit of your own research at home, that
Yes,
kind of thing.
exactly. Yeah.
And just to go back to that, like from what I know about FND, it's generally caused by trauma. Do you believe that? Is that what the
Um,
research says? Do you know,
yeah.
or does it
Well,
depend?
I think it can come from obviously a variety of sources, and trauma can absolutely be one of them. But I think one of the things I've read about is that it can be caused by anything that causes an overwhelm to the nervous system. And so
Yeah.
a lot of people will get it after having COVID or something. And when I
Yes.
look back on it, like I had MRSA just before I started getting really severe FND symptoms. And I'm like, okay, that does, like, obviously the trauma and chronic mental illness
An infection
definitely.
is a trauma to your body.
Yeah,
It is.
exactly.
Yeah.
Yeah, absolutely. And like I think that that's not acknowledged enough, and it's kind of like just perceived as what I call crazy bitch syndrome. And, yeah.
Well, that's all
Yeah,
syndromes, though,
that's
isn't it?
true.
That women
Yeah.
have. Like,
Yeah,
yeah, yeah,
exactly. But it's like it's kind of just like, oh, it's all in your head.
yeah,
And I've had family members say that to me, like, I don't understand. You have this. It's just in your brain. Why can't you make your brain work and walk? I was like, I don't know how to explain this to you, but it's like I have no control over, like, it's the networks in my brain just doesn't work properly.
yeah,
And it's just, like, and I wasn't told that when I was diagnosed, or at least I don't remember it because it was such a shock. I had to go away and do all this research on my own. I'm like, okay, so this is kind of the conclusion I come to on my own research, is that it can be, definitely trauma can play into it, but I think a lot of people will have pre-existing physical things as well, like, an infection, or something like EDS, just the trauma of living with chronic pain even,
yeah.
yeah.
I think there's two interesting points that you bring up. There is the post-infection
Mhm.
side of that, because the condition POTS that I was talking about earlier, like some people will have a post-infection type of that. Other people
Yeah.
will just kind of naturally develop it. And
Yeah.
I don't think I had post-infection because I just seemed to naturally develop it probably from 11 onwards.
Mm.
I probably had it a little bit before that, but 11 onwards, like most people, is when I started showing the signs. But I did have, like a lot of people, I had post infection ME.
Mm.
And because it was post infection, at least there was a bit of hope there, because
Yes.
after about 2 years, like the first at the beginning of the condition, I could be passed out for 20 hours. It was
Yeah.
horrific, just in deep comas, really, like
Yeah.
practically, like could not be
Yeah.
woken up. Whereas at least that I knew, because I was just had a bad flu,
Yeah.
and then I got very sick afterwards. And then they were like, this is just from the infection. They're
Hmm.
like, this is what we would call like a post-infection ME.
Yeah.
So I was lucky in that regard, and not that this will happen to everyone, but sometimes with post-infection, at least it'll go away a bit.
Hmm.
It can things can get slightly better over the
Yeah.
years. I think after 2 years, like I definitely have noticed a massive improvement.
Okay.
I would
Yeah.
say I barely have it now. Like I
Oh,
don't even
good.
like to say that I have ME now, because
Yeah.
I'm obviously I'm going to have a normal amount of chronic fatigue, but that's not the
Yeah.
same thing at all.
No, of course.
So
Yeah.
I do feel affected by it sometimes, but not as much.
Hmm.
And likewise, there's the high rise of cases from post-COVID
Yeah.
infections.
Yeah.
People now have ME from that and POTS from that. So I think
Yes,
there's all
absolutely.
these conditions that, and it's good in one way because a lot of awareness is obviously coming
Of
to, I would
course.
say, FND as well,
Yes.
in the same
Yeah.
way ME and POTS, because of COVID.
Hmm.
A lot more people are getting
Absolutely.
sicker. So they're like, well, hang on, because more people are getting sicker now, people want research done and they
Yes.
want this more spoken about. Not to say that if you have the post infection that it will
Of course. Yeah.
that you will go into like a remission state or anything. That
Hmm.
still
Yeah. You never
might
know,
not happen. Yeah.
unfortunately. Yeah.
And also then the second point I thought was very interesting is just the whole thing around trauma, because as they say, an autistic person cannot exist in this world and not have trauma.
Yeah. Yeah.
Just like that
It's
we
something.
experience
Yeah.
mini trauma every single day
Absolutely. Yeah.
from
Yeah.
just being autistic.
Yeah, and I never really realized that until you brought it up a few times. And I've gone through. I won't go into detail, but specific traumas related to issues in my life, and then I look back on things like experiences in school, and I'm like, I'd say I had a typical school experience for an autistic child. I'm like, I remember thinking, when I was a couple of years out from leaving after I left school, I was like, that was traumatizing, and then I would say, no, don't be silly, it can't be. But now, you mentioned stuff like that, I'm like, well, yeah, it was traumatizing for me.
Yeah,
And like every day is traumatic for an autistic person. Like it's
exactly. Yeah.
yeah, it's like when you, like, for example, one thing that I find, I suppose I would say traumatic, is the sensory overload. And like, my nervous system is constantly on edge. So if someone slams a door, an average person would just think nothing of it. But for me, I'm like completely wound up. I'll jump, I'll get angry. I'm like, that sounded so loud to me. I'm like, why are people doing that? Do you not realize how loud you're being?
Yeah.
And that can be quite, I know it sounds extreme, but that can be a trauma.
I definitely, yeah, you
Yeah.
use the word extreme there, and obviously, I think it's so easy to gaslight ourselves, but
Yeah.
we know our lived experience, and I know that people might think we're being dramatic. If people are listening to this right now and they're not autistic, they look. You just need to realize that autistic people experience the world differently,
Hmm.
and like I mean that in a very physical,
Yeah.
literal way.
Yep.
Things are louder to us, and I know everyone's, that's autistic is
Of
different.
course.
Everyone's got different processing ways and different needs, but in general, the world is a lot fucking louder to us.
Yeah.
It's a lot more stimulating. Lights are a lot brighter. Things are just more vibrant and
Hmm.
bigger. And to be honest, it's really hard on the other side for us to understand the neurotypical point of view.
Yeah.
Like I'll be like, I do think, and I know people laugh at this, but I do think a lot of us do have very, very, very sensitive hearing.
Hmm.
Not everyone, but if you do have
Of
the issues
course.
around, if you do have the issues around hearing and the issues around noise, then a lot of people will hear like very minor noises,
Hmm.
but really, really loud.
Yeah.
Like I used to watch films and I could not understand that. Like to me, the background noise was at the same level. So,
Yeah.
say a restaurant scene,
Mm.
the background noise would be at the same level as the
Yeah. Same.
main characters talking.
Yeah.
And I used to go to people like, why would the sound person do it? Like,
Yes. Yeah.
this movie's so shit. I can't believe
Yeah.
they created it like this.
Yeah.
And it's only when I got to an adult because people are kind of like, there's nothing wrong with the sound.
Yeah.
What are you talking about? And it's really hard to explain that to a
Yeah.
neurotypical person in the same way that I have no idea what way a neurotypical person hears.
Yeah.
And so I just have to imagine it
Yeah.
because I've been told so many times that I'm wrong. So I
Yeah.
know that I'm seeing and hearing things completely different.
Yeah.
But I don't think we get the same leeway back
No,
from neurotypical
definitely.
people in
Yeah.
fairness.
Definitely
So
not.
I do want to explain that. I know we sound very dramatic when we talk about the world is a different experience
Yeah.
completely in a very, and I don't mean in an emotional way, I mean in a very physical
Yeah.
way.
It is.
So I hope that people listening understand that and aren't rolling their eyes
Yeah.
at us for saying that. And yeah, and I think that trauma all comes into play. obviously the body keeps the score and everything else.
Yes, I heard that.
Wish
Yeah,
the body would stop keeping the score, in
honestly,
fairness.
seriously.
And in saying that, there is a lot around autoimmune
Hmm.
conditions and being autistic as well. Again, there's still a lot of research that is
Yes.
around that. Um, yeah, so it's some of the research, just kind of to go back to that as well. Some studies show that like there was certain subgroups there was one study in particular, and there were people who were like autistic people were kind of put into subgroups. Higher learning difficulties, you were more likely to have various autoimmune disorders and asthma,
Mm.
and things like that. And then other groups were less likely. So there is some research out there, but there isn't enough. And I think, research aside, there just needs to be awareness. And I'm going back to like this whole thing of like, I feel like if you're diagnosed with one, you need to be checked for the other.
Yeah, 100%.
Whether they're looking at EDS or FND. I think if you're just diagnosed autistic, they need to go, okay, let's go check your joints.
Yeah, absolutely.
There's like, why not? Like,
Why
I mean, I
not?
suppose we just don't have those style of hospitals here.
Yeah,
We don't
true.
have that kind of
Which is,
they don't work that way. No one works together.
yeah, it's, oh my God, it's just ridiculous.
Yeah, and
Like,
it's interesting the way they even phrased it to you, like, oh, sure, all you need is a bit of CBT.
yeah,
And like, even if you were extremely traumatized from massive events, and you're like, whether massive events or a collective of smaller events from being autistic,
hmm,
like, they make it sound like so easy just to go fix your
yeah,
trauma.
exactly.
Like, it's
Yeah,
not.
it's no, it's
Like
not.
a bit of
No,
CBT and you'd be
you'd be
grand.
grand.
Yeah.
Yeah, like, it's, yeah, no, that definitely. I think the stigma around trauma and, not necessarily PTSD, but just the general post-trauma experience is definitely plays into the bias against people with, autism and FND and EDS and stuff, because like, even if you've never had a big traumatic experience in your life, like getting sick like you do when you have EDS or FND is a trauma in and of itself,
Yeah.
and people don't realize that until, like, and I didn't even realize it until, and much like you, my now I'm in my late 20s, my symptoms are getting worse, and like, and sometimes I have to just sit there and like, this is actually quite traumatic to go from relatively healthy, able-bodied person to not really being able to do anything,
Yeah.
you know.
And on top of the trauma, just the everyday trauma of living with a condition and the grief of having your dreams stolen and
Yeah,
everything that comes
exactly.
with being disabled and physically unwell. I think there's also a lot to be said around medical trauma.
Yeah. Yeah.
Like, it's severe.
Yeah,
It's
it
severe.
is.
It's
It
years of
is.
fighting and advocating for
Yeah.
yourself, or maybe you're a parent out there advocating for your sick child.
Mhm.
You know how that is as well, I'm sure. It's traumatizing.
It is.
It's
It is.
traumatizing to feel like, especially because so many people do have to travel to London
Mhm.
and pay for themselves and do GoFundMe's and everything else. And it's
Yeah.
like, you're being kicked out of your own country.
Yeah,
You're being
exactly.
told constantly you're too sick.
Yeah.
And that's what I find harder to deal with, I have to
Me
be honest.
too.
Like, when I
Yeah.
go to appointments, and it's worse when they're nicer, so you can have a
Yeah.
really nice nurse, a really nice
Yeah.
consultant, and they're almost upset for you, and they're like, I'm so sorry, but there's nothing I can do because you're out of my realm.
Yeah.
And like, I do appreciate that honesty.
Of
I don't
course.
want a doctor treating me that doesn't feel competent to
Absolutely.
treat me at the end of the day. But
100%.
being told that you're too complex is being told that you're too sick for healthcare.
Yeah.
And that's why a lot of us have no
Yeah.
consistent consultants.
Yeah.
I am so lucky to have the private one that I have, but I have to travel hours to Cork for
Mhm.
appointments.
Yeah.
And I'm lucky. I'm one of the lucky ones to
Yeah.
have that.
Yeah, which is,
And I did recently, I had been to so many public rheumatologists, but again, it was always, sorry, you're too complex. Sorry, I can't. Like, I'd be afraid. They're almost afraid to hurt me and to dislocate joints.
yeah.
And I've tried to say, look, like, I just need you on the books. I need you
Yeah.
on paper in case there's an emergency. I
Mhm.
actually don't need, I'm not expecting you to cure me.
Yeah.
But all in all, it's always been, no, I'm sorry, I can't.
Yeah.
And I eventually, only last year, after like 10, 15 years of like consistent trying and going to so many public ones, I now have a public one technically on paper,
Mm.
but still my private one is doing most of
Yeah.
the work,
Yeah. The
all the
heavy
like
lifting.
medication, all the bulk work, especially because when you think about like something like, and I'm sure FND is quite similar,
Mm.
that like with EDS, it's not really one consultant that you need. Need to
Yeah.
see maybe one good rheumatologist, but they need to know about all the comorbid issues.
Yes,
Like, there's no
absolutely.
point in me seeing a rheumatologist who knows about EDS but doesn't know about gastroparesis.
Mhm.
For anyone that doesn't know, that's the stomach condition I have that a lot of people with EDS have. Even if you don't have gastroparesis, you probably have other similar stomach issues. But basically, it's an extreme slowing of the digestive system, which is a huge complication.
Mm.
But like going to a EDS consultant, like a rheumatologist, they should know about all of the comorbid conditions, and that way you don't need to go to 100 different doctors.
Mm-hmm.
I say that I'm still currently trying to find a gastro,
Yeah, God,
but
never
again, too
ends.
complex. No one will take me on.
Yeah.
And even recently, my GP wanted to refer me to the nutritionist. Waiting for that. But she's pretty. Even my GP doesn't think she'll take me on.
Jesus
Too
Christ.
complex. And I'm like,
It's ridiculous.
I understand this idea of like not wanting to give out medical advice when they
Yeah.
don't feel qualified. But why am I dealing with it myself at home?
Yeah,
I'm not
exactly.
qualified to give myself nutritional advice.
Yeah, it's
I have
just
no medical training.
yeah, we're just left in the trenches to
Yeah.
kind of, and it's no wonder then that we kind of a lot of self-diagnosis, because there's like, whether it be for treatment like, nutritional support or initial diagnosis, like there's just nothing there.
Yeah.
And you're kind of just told, you're like, you have kind of been told, yeah, you probably do have this, but like like I'm like, like, okay, but
But they'll just never put it
yeah,
on paper. They'll
yeah,
never admit it. And I
yeah.
do think, I don't know if this is controversial. I don't give a fuck because we say it in private, so I'm going to say it out loud. I do think that consultants are afraid of the HSE. The
Yeah.
HSE do not want numbers of how many patients in this country have Ehlers Danlos
Oh,
syndrome. And I'm sure it's similar to other conditions because
yeah.
then they have to pay for us to be able on the schemes to be
Mhm.
able to travel abroad.
Yeah.
But if the condition doesn't exist here, they don't need to do that.
Yeah.
I don't know about FND, but I know the HSE have been asked before for figures. And I think years ago, I think they tried to say there was only like 25 in the country. Obviously, there's not only 25. It's a
Yeah.
genetic condition.
Yeah.
Just say the prevalence, I think, of Ehlers Danlos syndrome. Again, there's 13 types, so it's really hard to tell. I think that the numbers have changed over time. It's called a rare condition.
Yeah. I've
But even
noticed.
like because there's 13 types, honestly, it's the cusp of being rare. Particularly if you have hypermobility spectrum disorder, or the hypermobility Ehlers-Danlos syndrome. Particularly, if you've got those two things, then you're really not that rare.
Yeah.
I think they generally say 1 in 1,000.
Yeah.
However, there was a UK study done, and like I say study, but it was just like looking at hospital figures of people presenting who were diagnosed with EDS in 1 year or 1 month, whatever it was, to this hospital. And from those figures, like these UK figures, they're looking at more like 1 in 500.
Yeah. It's really.
So like that's really common.
Yeah.
And when you think of all the people that aren't diagnosed,
Yeah.
because
Exactly.
they can't pay for the diagnosis, even
Yeah.
if they found a doctor here.
Exactly.
You're not going to find a doctor
No,
here to
you're not.
diagnose
No.
it. Like
No.
I do know that some people in this country have been diagnosed with EDS, like like publicly, but just kind of by accident.
Yes. Yeah. I've
And the
heard.
funny thing is, though, again, they will not stand by that, the public
Yeah.
doctors. So they might diagnose someone 1 month, and it's not that hard to diagnose. There's a thing like called the Baton score. There's obviously, you look at family history.
Yeah.
If you need to, you're sent to a geneticist, but most people do not need that because they don't have the type that will find the genetic markers. But I have, in the work that I previously did, I haven't done any advocacy really in ages, but in my previous work, I was trying to put together a list of possible public rheumatologists. So I was asking people in the community who diagnosed you, and if they said the name of their doctor, I was like, great. So I was reaching out to those rheumatologists going, hey, I'm trying to compile a list to help other patients. And they were like, no, they didn't want to be on the list. So I was like, right. And then I found out from other people, oh, I went to them and they were actually terrible. So depending on what year you went, I feel like there was people from above. There was definitely people from the HSE. There's definitely people above them not wanting them to spread this diagnosis. And so you might hear of a consultant being very good publicly, and then all of a sudden the following month they've changed their tune and EDS all doesn't exist anymore. Basically does not exist anymore. And like I could kind of understand maybe for something like, I feel like FND is still less known about FND. Whereas like EDS, yes, technically it's still kind of a newer condition, but there's big, massive organizations like the EDS Society in America who like obviously have raised millions for research. So it's like you cannot turn around and go, oh, it doesn't exist. Like it exists in America, it exists in the US. Like I mean, whereas like definitely I can see what FND, it's still in its infancy.
I was just going to say,
very much still in its infancy, but it's just ridiculous that they're still trying to say this about EDS and still trying to push it down and pretend that it doesn't exist in this country. And that might sound really paranoid, but I 100% know that these doctors aren't just changing their minds out of nowhere. They're not
way. No.
They're not like being validating 1 month and doing the Baton score and the next month they're like, don't know what you're talking about.
Yeah,
Like there's something's
yeah,
going
it's
on there.
something, it's fishy, yeah,
Yeah,
and it's
and I
just,
know what happens with other
yeah.
conditions as well.
Of
Like it's just,
course, yeah,
yeah,
it does,
it
but
there
yeah.
it's and I will say I've had very candid conversations with politicians in the past as well who absolutely agree with me. I mean, I was thinking it anyway, but they would say, look, if they play it down and it doesn't exist, then they don't have to pump any money into it,
Yeah,
and they
it
don't have
all,
to help you.
yeah.
Um, and honestly, that's horrendous.
It
That's horrible.
is. It is. It's all comes back to capitalism at the end of the
Yeah,
day.
yeah.
Yeah.
I feel like all of
Yeah.
these episodes to date have all
Yeah.
came back to
Yeah.
capitalism.
No, it's so hard not to. Yeah, it is. It's awful. And as you said, like there's just no acknowledgement of it. And then that's kind of leaving people like you and me in limbo. It's like, like, and then like my GP is very well meaning, but I remember a couple of months after he referred me to London, I went in for something else. He was like, "Oh, so you'd be going over," this was like summer. He's like, "Oh, you'd be going over in autumn, will you?" I was like, "No, where do you think I would get that kind of money?"
Yeah,
Like,
yeah,
it's interesting to see that as well, like from a perspective of, now obviously I don't know, maybe this doctor does have illnesses himself, but to see it from someone who probably doesn't, and who doesn't live in the kind of world that you and I would, and it's like, but you think, like, it's not easy to kind of get up the money for a consultation. It's like 300-400 pounds for 45 minutes or something, and then
yeah. And then of
it's
course flights and accommodation
exactly,
and food,
yeah,
everything,
yeah,
everything is so
everything,
expensive.
yeah.
And like most people have a GoFundMe
Mhm.
for that reason, and their friends and family do fundraisers.
Yeah,
And it's just ridiculous.
it
It's
is.
ridiculous nonsense that we
It's
have to do that in the first
bullshit.
place.
Yeah.
And I find with a lot of people, I'm sure it's the same with FND, but I know a lot of people with Ehlers Danlos syndrome, they're so busy trying to save money to get their children diagnosed that they
Yeah.
can't get themselves diagnosed.
Yeah.
And that's a really dangerous and horrendous position
It
to be in,
is. It's awful.
that you have to like put your children first and
Yeah,
not think about your own health.
exactly. Because like it's just so, as you said, like it's EDS impacts every part of your health and every part of your body, and you just don't know what it can do to you from one minute to the
And
next.
I'm sure it's probably very confusing having something like FND, and
Yeah.
having, you're probably half the time, I know I've got comorbid conditions like the gastroparesis and the POTS, but I can still tell which is which, if that makes sense.
Yes, of
With
course.
something
Yeah.
that physically affects you like FND
Yeah.
and the EDS, can you always tell what symptom is from which
Not
part?
really, no. Yeah, that's the thing, is like, because I'll have like, I mean, I've got like a distorted gait anyway now from the FND, and I'm like, but also because I've got a really wank, the really bad hip
Yeah,
because of the, I presume, EDS. And it's just like, okay, am I walking funny because my hip is bad and my sciatica is playing up, or is it my FND playing up? I'm like, it's, or like, and then I think of like my limb weakness. I'm like, okay, but I can feel like my sacroiliac joint is pinching something. I'm like, that's not going to help the limb weakness. I'm like, that could be, or even if I haven't eaten properly in a few days, I'm like, oh, I can't really walk. I'm like, and then I'll eat something substantial for the first time in a few days. I'm like, oh, I'm okay. And I'm like, what's with that? You
yeah,
know,
yeah,
it's like, and then there's no one to turn to for answers.
yeah.
You know,
And again, just as you said earlier, like the place to turn to answers is definitely community.
yes, absolutely.
I will. I'll put up the links, important links now on your screen if anyone wants to take a screenshot, just for further reading. But also, there is a Facebook group there for Ehlers-Danlos syndrome that I would consider joining. If you know any FND links, send them on to me as
Yes,
well, and I'll make
absolutely.
sure to put them up.
Perfect.
I will say that I just, something I didn't touch on earlier is something I'd noticed, the like little bit of research was congenital abnormalities can also be linked to being autistic. But then I wonder if that's just being linked to ED. You know, it's
Mm.
hard to know which is linked to which.
Yeah, it
Where are we
is.
on this tree, like
Yes,
as
it's
such?
so.
When I think of congenital abnormalities, I know that I had hip dysplasia, which is very common, but
Mhm.
it was harder for them to see my hip dysplasia because of my hypermobility,
Yes, that
which
makes
apparently
sense.
can be quite common. So in fairness to my mum at the time, she did try to tell the doctors, I'm pretty sure her hip's dislocating. And they just
Yeah.
like laughed her off and didn't notice. And then by the time I started walking and I
Mhm.
couldn't walk properly, they were like, oh, something's wrong with her hip. And my mum was like, yeah, I know, I told
Yeah,
you.
no shit. Yeah.
But it was harder for them to see that with the hypermobile joints,
Yeah.
apparently.
Yeah.
That's what I gather. A lot of people seem to have that.
Yeah.
But yeah, hip dysplasia does seem to be a bigger thing in our communities.
Mhm.
And it's so funny, like when I think of birth defects, I have like such small minor things. that look on their own I would never have thought of. Like
Hmm.
things I've just been told, well, that's funny, you've got like a little missing bone there.
Yeah,
Or that's funny, that bone is smaller than it should be for an adult size.
yeah.
Like these
That's
random things have
weird.
came up in the past when I've
Yeah,
been tested for something else,
yeah.
or I've been getting like a line fitted in me, you know, and they've like
Hmm.
had to like make it smaller than usual. They're like,
Yeah,
oh, that part of your body is in a normal shape or in a
yeah.
normal, and like, and even I've had some bladder issues recently, and they
Mm.
were like, oh, that's shorter than it should be, and I
Oh
was
my
like, what are
God.
you talking about? Like,
Yeah,
so there's like all these like small minor abnormalities, I
yeah.
guess, that they were just congenital. I was just born with. Um, so it's interesting to read that and to kind of go, okay, is that part of being autistic?
Yeah,
You
you would
know,
wonder, like,
yeah. I know a lot of us have dyspraxia as well,
yeah, I
which
was
is
just gonna bring that
yeah,
up. Yeah, yeah, it is the link between, and I think a lot of people with EDS have scoliosis and stuff like that as well.
yeah,
Like, yeah,
yeah.
and it's like, I mean, I don't know if I mean, allegedly, I wasn't born with scoliosis. I think I got it, got it as a result of an accident. And
Okay,
yeah, I mean, we don't know for sure
yeah.
because I was diagnosed late, but I mean, that's,
Yeah, you make a good point in that the like a lot of the children that have scoliosis have EDS as well, and
Mhm.
that's just a double fight
Yeah,
for the parents at the end of the
it
day.
is. Yeah.
And I think a lot of the narrative around the way we've heard the government talk and about scoliosis, the children with scoliosis, and the way that they've been talked about, I think, on their files as well, as if like, well, they don't need surgery because they're doomed to
Yeah,
die
oh
anyway, and it's
God. Yeah,
absolutely
it's
horrific that they've
disgusting.
like found that in some
Yeah.
of their files.
Ugh,
And to be perfectly honest, I think that's the way EDS is often seen.
I agree.
Like I do not have vascular EDS. Yes, I'm slightly higher risk coming up to things like surgery, but I am not like when doctors talk to me and talk about me, they just talk of like I'm about to die any
Yeah,
second, and
it's so it
that's
doesn't help.
it's hilarious though. It's not
Yeah.
true.
No.
I've only ever been at medical risk because of per research,
Yeah.
because of the hospital, because of the doctors. And I know that sounds brutal and horrible,
No, but it's true.
but it is true.
Yeah,
It's medical negligence.
it
I'm
is.
not at risk. I'm mostly not at risk of dying because of my conditions.
Yeah.
I'm
No,
just
if
not
you
like,
went to a different country, you'd be okay.
yes.
Yeah.
Yeah. And
Yeah.
in a lot of places, and
Yeah.
obviously most places still need awareness,
Oh,
but
of
it
course. Yeah.
is, it is at the minute definitely worse here.
Yeah.
And I think that really horrified me to see the kind of crossover with the way that those children are being treated and the way they're being spoken about.
Yeah.
And the thing is, at the end of the day, that if you diagnose and treat things earlier, that
Yep.
you are going to have a better prospect. You're going to have more mobility,
Yeah.
and we
And
have
it's
obviously it's more noticeable with something like scoliosis,
hmm
something where a child can physically have surgery to fix them.
yes.
But similar to FND and EDS and other conditions, having that awareness will still help the outcome, will still help
Absolutely.
physiotherapy and everything else.
Yeah. And like, even just knowing for yourself, like, okay, this is, EDS or whatever, that I'm dislocating, I'm spraining my arm when I
Yeah,
change my bed
being able to
because,
protect your joints.
yeah,
I hadn't a
exactly.
clue when I was a kid. I
No,
didn't
me
use
neither.
any mobility aids when I could have done,
Yeah.
even just with like splinting or like my bracing up a little
Mm-hmm.
after dislocation,
Yeah.
protecting those joints, and I didn't have a clue,
Yeah,
so I
you
didn't do
you
that.
just don't know, and then it's like, and like you said, like, a lot of us show warning signs as kids. Like, I've got, reports from physio and occupational therapy from when I was like under 10, and they're like, oh yeah, Erin is hypermobile and lacks ligaments. I'm like, red flags, people. Like,
Yeah,
but they just don't go anywhere with it.
yeah. Well, I'll leave that. We'll leave it there. I think,
Yeah,
Erin. Thank
sounds
you
good. Go
so
on.
much for coming in today.
Oh, thank you.
And I think we're going to hopefully be doing another episode with you soon. So,
Hopefully, yes.
uh,
Yeah,
thanks so much
hopefully.
again.
Thank you.
And to all our listeners out there, until next time, stay hydrated, punch Nazis, and live beyond the script. Go gently, and we'll meet you back here.